Welcome to another episode of the News Roundup. On today's show, we'll be talking about how the NCAA is now treating athletes who have previously contracted the virus as fully vaccinated, meaning they are granting players and coaches exemptions so long as they have already been infected with the virus within 90 days of the vaccination mandate. We'll talk about what is going on here. And then, in Scotland, a disturbing trend where the vaccinated cases are skyrocketing. We'll discuss what's going on here. And so, from Trial Site News, I am Adrian, and our episode starts now. So, the nation's largest collegiate sports organization, the National Collegiate Athletic Association, otherwise known as the NCAA, issued new guidance last week exempting student athletes and coaching staff who have been infected with COVID-19 within 90 days from vaccination mandates. Meaning, student athletes with COVID-19 infections are exempt from vaccine mandates by the NCAA. Now, under the NCAA's guidelines, a person who has had a documented COVID-19 infection is considered the equivalent of fully vaccinated. Fully vaccinated also includes recipients of the Johnson & Johnson vaccine within 2 months, receipt of the Pfizer vaccine within 5 months, and receipt of the Moderna vaccine within 6 months. These guidelines were developed for what the NCAA calls Tier 1 individuals, meaning student athletes, trainers, coaches, medical staff, physical therapists, equipment staff, and officials. Now, why this is important is the Indianapolis, Indiana-based nonprofit organization regulates athletics for more than 480,000 student athletes competing at more than 1,200 North American institutions and conferences. The NCAA is the largest collegiate sports sanctioning organization in North America and is particularly dominant in basketball, governing nearly 2,200 teams cross-country, with more than 2,000 teams, and baseball and softball with nearly 2,000 teams. And so, these new guidelines might influence other sports leagues and membership organizations to adopt similar approaches, acknowledging natural immunity as well as vaccines. As of now, the professional sports leagues within the United States, such as the National Basketball Association, NBA, the National Hockey League, and the National Football League, or the NFL, all have different requirements for participation. For example, in the NFL, 94% of all players are vaccinated, as well as 97% of NBA players. Of the 700 NHL players, only 4 currently are unvaccinated. All 3 professional leagues have different protocols for vaccinated and unvaccinated players. Vaccinated players travel more frequently and wear masks less often. Teams also adjust guidelines according to local public health requirements. Meanwhile, in Europe, a previous COVID infection allows individuals to get a digital EU COVID certificate, which functions as a vaccine passport. Europeans treat a person who has had the disease as if they had been vaccinated. The argument here is that a large amount of research has provided evidence that natural immunity confers as much, if not more, protection from infection and severe disease as vaccines and should be accepted by authorities in lieu of mandated vaccinations. Or so it would appear in the EU. In any case, back to the NCAA. They have announced that their championship basketball tournament known as March Madness will not be played in a quarantined bubble, as it was last year. This is important for them, as the March NCAA basketball tournament generates enough money to cover the cost of all its other sports activities for a single year. And of course, we will be keeping you posted on this story as it continues to develop. Now, for the second story of the episode, we're going to talk about how fully vaccinated persons in Scotland are now being hospitalized at greater levels than the fully unvaccinated, with an ever-growing number of the elderly becoming seriously ill because of vaccine durability issues. Due to the waning immunity of the COVID-19 vaccines, the elderly and other at-risk cohorts raise the fully vaccinated COVID-19 hospitalization levels higher than the unvaccinated. Now, of course, the vaccinated make up a larger percentage of the total population. Thus, with breakthrough infections, the fully vaccinated represent a greater number of total people hospitalized. Nevertheless, this data counters the narrative that it's primarily the unvaccinated that populate the great majority of hospital acute care and ICU beds. Even in the press in Scotland, such as the Herald, now report that double-vaccinated Scots are now more likely to be admitted to hospital with COVID than the unvaccinated, amid an increase in elderly people falling ill due to the waning immunity issue. Regardless, back here in America, the President of the United States has gone on the record again in a recent speech that this remains a pandemic of the unvaccinated. President Biden elaborated that the unvaccinated end up in the hospital much more, while the vaccinated overwhelmingly experience mild to no symptoms when they experience breakthrough infections. Yet, from Canada to England to Scotland, we here at Trial Site News have been following reports that an ever-accumulating number of hospitalized patients are fully vaccinated. An example of this, going back to Scotland, as recently reported by the Scottish Government, this is why public health authorities seek to better understand the breakdown of hospitalized patients due to COVID-19 versus those hospitalized with other conditions. In the Scottish Government's latest report, 68% of COVID-19 related acute hospital admissions involve a primary COVID-1 diagnosis. This figure equaled 75% in March of 2021. Deaths are down markedly from previous surges. Despite some of the highest vaccination rates in the world, cases have skyrocketed due to the Delta wave, and now the even more infectious Omicron variant of SARS-CoV-2 is here. This latest surge started in early December, just when it seemed that new daily infections appeared to be on a downward trend. However, by January 3rd of 2022, all previous records of daily new cases were shattered, with over 51,000 cases in just one day. Now, it is worth noting that deaths related to COVID-19 are also on an upward trajectory based on the sheer number of infections. However, overall, the death rate is far lower than during the first couple of COVID-19 surges, dating all the way back to 2020. This, of course, can be attributed to a number of variables, including vaccination. So, of course, the question is, what about vaccinations? Well, Scotland's population is heavily vaccinated. By January 6th of 2022, about 91.5% of the population aged 12 and up were at least partially vaccinated, while 84.3% of the population aged 12 and up was classified as fully vaccinated. Public Health Scotland reports low levels of deaths among the vaccinated, indicating the benefit of vaccination in mitigating the risk of death. It is also worth noting that by the first week in January of 2022, 63.6% of the population aged 12 and up had received a third booster dose. And of course, we will continue to report on this story as it continues to develop. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I'm Adrian, and I will see you all